If you are a nursing associate, these are the stations you need to prepare for your UK NMC OSCE exam. Let's get into it. For the AI stations, you're going to have a patient scenario for you to complete your assessment station where you're going to do an A to E assessment and then complete and use 2 charts. For implementation, you are to administer oral medications and it is based on the scenario that you get. And then for evaluation, you are going to hand over the patient's care, whether to a colleague or to a nurse or a doctor who is going to receive the patient from you. For the skills stations, these are the stations you are going to be examined on. We have the administration of inhaled medication, fluid balance, pressure area assessment, pain assessment, and hospital admission. Now, out of these 5 stations, you have 3 performing stations and then 2 non-performing stations or silent stations. And these are the stations that make up the silent stations. You have fluid balance and you have the pressure area assessment. For the performing stations, we have administration of inhaled medication, pain assessment, and hospital admission. For the evidence-based practice, you're going to have diabetes as the station you will be assessed on. And then for professional values, you're going to have confidentiality. These are the stations the NMC expects you to cover for your OSCE exam. You realize that there are no additional stations you're going to be assessed on apart from these specific 10 stations, making your preparations quite easier compared to the other healthcare professionals. So make sure you master these stations to get yourself fully ready to go and pass on your first attempt. Don't forget to leave some few likes, share to a nurse who is currently preparing for the Nursing Associate OSCE exam. See you in the next one.